Hello and welcome to the Disabled People's channel. My name is Steve and I'm here with Beth, Whitney and Julie, and we're going to have a discussion around various topics along the lines of their children who are kind of born with heart problems, and in particular the kabuki syndrome we'll be talking about a bit as well. If I just ask you each to give a little bit about yourselves, and so we'll start with Beth.
Hi, I'm Beth. I have 3 children. My middle child is a boy, and he is my child who is medically fragile. The first thing we ever discovered about him was his heart disease, and that was after he was born. He's almost 5 years old, and he was diagnosed with kabuki syndrome at 18 months old.
Whitney?
Hi, I'm Whitney. My daughter is Briley. She was born with multiple congenital heart defects, which were found in utero at 18 weeks. She had a few open heart surgeries before her first birthday, and then last year she was actually transplanted because she was in severe heart failure again. She's 5 years old and thriving now.
Thank you. And Julie?
I'm Julie. I am mom to Christian. He is 11. We didn't know anything was wrong with his heart until he was in the NICU, and they did all kinds of testing to try to see what was going on, and found out he had a congenital heart defect then. Was later diagnosed with kabuki syndrome he was about 3.5 years old.
Let's start off with the congenital heart defect. Who wants to kind of explain what that means?
I guess it was CHD, congenital heart defect or disease. I learned so much just kind of being thrown in. So Finchley was born with 4 different heart defects. Coarctation of the aorta, which needed the immediate attention, and that's why he had his heart surgery. He has hypoplastic mitral valve, bicuspid valve, and he had 2 VSDs, which is a ventricular septal defect, which means a hole in the heart. That's the fancy name for hole in the heart. He had 2, one closed up on its own, and he still has 1, but it doesn't affect him. In our community, we just kind of call our heart kids snowflakes, because there's so many different things and combination of defects that can go on with your child's heart, or obviously anyone's heart. Essentially had the same repair. I guess there's several different ways you can repair the coarc, or the narrowing of the aorta. And we also did an end-to-end repair where they just cut out the narrowed part and then put it back together. But because it was pinched, that was cutting off blood and oxygen supply to Finchley's lower extremities. And so obviously that's very dangerous for the blood not to flow correctly through the entire body. And so to have that, we obviously check that. We have an echocardiogram once a year, and we make sure that repair is still intact, because there have been other cases where there's been a re-coarctation or re-narrowing of that same spot where, and that is life-threatening, where the VSD, the hole in the heart, depending on where it is in the heart, can cause damage. But where it is with Finchley, it's small enough, and it's in a spot where it's not bothering the rest of the heart's function, and it's not causing any problems in that way. But it's the mitral valve, the hypoplastic mitral valve, the one that's spewing and leaking a bit, that we have to really watch, because we would have to have a surgery on that. Again, I think it's a gradient scale, and the lower the number, the better for Finchley.
So Briley's congenital heart defects were found in utero. We went to a specialist at 21 weeks, and they found that she had the coarctation in her aorta, which is basically like, you think of like a pinched straw. Part of her aorta was just super narrow. And then when she was born, we also found out that she had 2 VSDs, which are holes in her heart, and a bicuspid aortic valve. She had surgery to fix all of that, which basically she had an end-to-end repair for aorta. So they basically cut out the narrowed part and suture it back together. And then for the VSDs, those are just stitched up, from my understanding, basically. The problem with VSDs is one of hers was in what they call the electrical part of her heart. So when they tried to close that, she went into heart block. So that's what caused her to need a pacemaker. And then with her pacemaker, it caused her heart to basically like stiffen up, and she needed a different type of pacemaker to help that. And then transplant is obviously a last resort. You want to fix your heart as much as you possibly can before you just jump to transplant. I know a lot of people think about congenital heart defects and they say, you know, why don't you just give them a new heart? But it's just trading one issue for another. With transplant patients, you have to have biopsies often to make sure that you're not rejecting the heart. You have to take medicine daily. Briley has to take what's called Prograf. She has to take it every 12 hours, every single day. It has to be on time. It can't be every 15 hours. It's a timed medication. And it's a lifelong thing. For the rest of her life, she has to take this medication or she's at risk for rejection. And then with rejection, it's either hopefully you can treat it or you would need to be retransplanted. And once you've had a transplant, that doesn't mean that you can be listed again. You have to go through the whole process again.
We always look at the tips of the fingers. We look at the lips, and, you know, we make sure, because they're blue, you know, if your heart's not working correctly. Those are the type of things to look for. That we watch his breathing during different activities, and we make sure his breathing is smooth. If he's gasping for breath or it seems like it's hard for him to breathe, you know, kind of the heart and the lungs really go together when you're talking about CHD. So you just kind of get an eye for that. But again, you know, you learn so much about the heart that so much can go wrong with the heart.
Well, even with our kids, they both have coarctations, they both had VSDs, but Briley went on to have a pacemaker placed for complete heart block after having her coarctation fixed. Then she needed another pacemaker 3 months later, and then now she's transplanted. When your son, he only had one open heart surgery, correct?
Yes.
Mm-hmm.
That's all we did. And now we do 1 year checkups with the cardiologist. And we just had our 1 year last. Everything is just kind of stabilized. His repair is still stable. And his VSD, again, is not causing any problems. And his hypoplastic mitral valve, which is basically the way the cardiologist explained it to me, was if you hold a hose and, you know, if you just turn on the hose and it just kind of drips out, but if you put your finger there and it sprays out, that's kind of what his valve is doing. And so the gradient on that, the higher the gradient, the sicker the heart. I say, will he need another surgery when he's a teenager, when he's an adult? And our cardiologist said, will he need another heart surgery between now and the time he's 99? Probably. So it's just kind of one of those things that we just have to continue to monitor, but he's stable for now.
I think it's just because you never know. I mean, Briley did so well for 2.5 years. She had no cardiac interventions, no cardiac related hospitalizations. We had other issues going on, but cardiac wise, she was doing great. And then we went to a normal 6-month cardio visit and were put in the back of an ambulance and rushed to ICU. So, I mean, they have no idea what's going to happen. These kids' hearts can look good today, and tomorrow we wake up in the hospital.
How old was Briley when she had her first pacemaker?
She was 15 days old for her first pacemaker. She came out of the operating room at 6 days with the external pacemaker, and that was never turned off. She had to have that until she got her permanent pacemaker. Okay.
And Beth touched on kabuki syndrome just now. Julie, do you want to explain kind of a bit about that and how you found out about it?
Christian's journey, he's 11 now. He had all kinds of symptoms. One day, he was about 6 months old. I was Googling, and I typed in across the Google bar every symptom he had, and kabuki syndrome popped up.
What kind of symptoms do you get with that?
So Christian has a very low muscle tone. Christian has a type 2 kabuki syndrome, which it's an X-linked syndrome, but with him, it just happened by chance. I'm not a carrier of it. So, but in the boys that have the kabuki syndrome type 2, seem to be more severely affected physically and cognitively. So he has low muscle tone. He didn't sit up till he was 2.5, and started crawling about 4.5, and now he can walk a little now, holding our hands, and we're just very slow progress, but it's a low muscle tone and hypermobile joints that cause such physical delays. He is cognitively very delayed. He has not spoke a word yet, but he understands pretty much everything we say to him. So we pretty much know him. I always say 99.9% of the time I can figure out what he needs. You know, it's when he's sick that it's hard. But other than that, he's had recurrent ear infections, which is a symptom that a lot of kabuki kids have trouble with. And he's mostly tube fed, and but basically just the low muscle tone is what causes most of his delays. But overall, symptoms aside, he's probably the happiest kid you would ever meet. So
he is very happy.
So he's makes everybody's world just amazing. And he works hard at it.
That's really encouraging to hear. People would maybe assume that if they've got so many different difficulties, then they might struggle with it. But
I think we tend to focus on the difficulties and symptoms a lot, and then I know when someone new is meeting him, they're like, well, what, like a new therapist, well, can he do this? Can he do that? And I'm like, no, but he can do this. We need to focus on the happy and good side of everything once in a while too.
Kids are really good about controlling themselves, and if they're running and they do get tired, kids are good about sitting down and taking the break that they need. But honestly, there's no way to really know if they are doing too much. We don't know. We don't know if their heart is working too hard.
Yeah, and I've had to ask our cardiologist different questions from early on. I remember asking our cardiologist, is it okay to let him cry? Because I thought him crying was going to overwork his heart. And so I've had to ask those type of questions to our cardiologist. How much is too much? Is he okay to run around in the yard? Is he okay to climb things? Is it okay for him to cry and have a fit? Especially because how do you discipline and set boundaries for a child who's not allowed to cry? And so parenting him early on was really hard, but it's almost harder now that he's older, but he has those behavioral delays and those mental delays. So he still has meltdowns, but thankfully I'm okay with that now because I feel confident in my cardiologist. We did go for genetic testing finally at 18 months. And as soon as we walked in, as soon as the doctor walked in and saw his face, because a lot of the kabuki kids have the same facial features, and that's where the name kabuki syndrome comes from. It's from the kabuki theater makeup technique. I honestly don't know much about the genetics of it, but same as Julie, when I Googled it and saw the list of common defects, I was checking everything off the list. And honestly, that made me feel a lot better because we were from 10 days old with the CHD. Then they found out a couple months later, they saw on a random x-ray that he had a butterfly vertebrae. He has those fetal finger pads. He also has low tone, chronic ear infections, all of that. So, you name a specialist or doctor, we see that. We see that doctor. We did get over his kidney issues. He was on antibiotics for a year because he had some kidney reflux. But that resolved itself on its own. So that's good. That was one less doctor we had to see. But he had a feeding tube, an NG through the nose, until we switched to a G tube through his stomach for feeding. And we got that out about a year ago. But he still is low on the weight part. Like I said, he's almost 5, but he looks and acts more like a nearly 4-year-old.
It sounds like they're all very used to the hospital.
Unfortunately.
But Christian actually has surgery on Wednesday, so we'll be back.
What is it for this time?
So he's getting more tubes put in his ears. So his last set come out about a year ago, and since then, anytime he's gotten a cold, his eardrum ruptures, but it doesn't just rupture. He ends up getting vertigo and vomiting till he cannot stop vomiting, and we end up in the hospital.
What is it? Does Briley just deal with her heart, or does she have other medical issues?
Just heart stuff right now. She used to have a lot of blood sugar issues. We went through all the genetic testing to basically find out that her low blood sugar is probably just her normal, and we would have never known about it if she wasn't in the medical eye all the time. And she has her 1-year biopsy coming up on the end of July.
Yeah, we've obviously established that you're Americans. So Beth has mentioned that she's in Atlanta. So is there a lot of support for the heart kids?
Yeah, so in Atlanta we have a group called Kids at Heart, which is a group that the hospital actually hosts, I guess you could say. And they do events like a Christmas party, and obviously with COVID, all of them have been canceled. But we do a big CHD week event, which is in February. I think last year was the aquarium, and then they go to like this airplane. They have a ball party, and then every month we have dinners and stuff like that to get together.
Yeah, so the once a month dinners are at the hospital where the cardiac unit is, and a lot of times a family that is in the CHD community will provide dinner, and then they'll have a speaker on a topic such as what we're talking about now, parenting a child with CHD, or any matter of topics that really help the parents to navigate their next move, or to get some extra resources, or at least just emotional support as well. And then Whitney and I are also a part of a Facebook group, and same with Kabuki. I'm on a Kabuki parents Facebook group and a Heart Mom Facebook group. And so, if you're having trouble, or you're stressed out, or you're not sure exactly what's going on medically, you can just chat to a ton of moms and parents that can say, this is going on with my child. Is this normal for heart kids? Is this normal for Kabuki kids? Does your Kabuki kid do this, and this? And it's usually, when I do it, it's a resounding, oh yeah, that happens all the time. And you're like, okay, good.
I feel like it's just reassuring to have another mom's perspective on something instead of just the doctors. Like, of course, we trust our teams, we trust their opinions, we trust what they say, but it's more comforting to hear something from another mom that's been through our situation. Like when we were waiting for a heart, I had multiple other transplant moms come up and sit with me and just talk about what to expect and how the next year is going to go, things like that.
And what was the best bit of advice that you were all given when you kind of first found out about it?
I think the best advice for you as a mom when you're first finding out that your kid has a congenital heart defect and is in the hospital is you have to take care of yourself.
We all have spouses who were there at the hospital, who are there currently with us during this journey. And everybody deals with stress differently. Everybody's stress manifests in different ways. So that was something that Antony and I had to navigate, because I did not want to be at Finchley's bedside with all the wires coming out of him. at heart surgery time, but I didn't want to leave the hospital. But I also didn't want to entertain visitors. So I was a weird, like zombie time for me.
I feel like that's another thing. Like, it's okay if you don't want to sit bedside when they're intubated and sedated and have chest tubes and their chests are open and everything else. That's okay. I think a lot of moms think they have to be bedside to be a good mom or to be there. But it's okay if you're outside of the ICU and you're, just coming in to check on them. That's okay. It's okay to not put yourself through that emotional stress of sitting there 24 hours a day.
Yeah, my husband and I kind of, I'm the one that's on pins and needles and can't sit still. And, anytime Christian's in the hospital and my husband's cool as cucumber, and I'm always like, how are you just sitting there? And like I have 5 billion thoughts running through my head right now. And we actually just had to make the decision this week because he has surgery on Wednesday and they'll only allow one person at the hospital. So we're like, he was like, it's me, I'm going. And I was like, what? I've never not been there, so it's odd, but he was like, he's going to be fine. And you get so nervous and so anxious and I don't, so it'll just be, we just had to make the decision. So,
but when you speak to a CP parent or a CHD parent, you can just say what you need to say without explaining it further. And that takes, there's no price tag on that, to be able just to speak and be supported and be understood without having to explain it, because they already.
Yeah. I can't go to my other friends and say, I had to change Riley's G-tube today and this happened, because they're like, you had to do what? You didn't take her to the doctor for that? And they just don't get it. But if I go to somebody else that kid has a G-tube and I'm like, oh, I changed her G-tube and this happened, they're like, oh yeah, it happens to me all the time.
Or try this. This might help you next time.
Yeah.
That's one of the things that I've learned for my condition, and I know several others have as well, is that even if there's not the physical support groups, Facebook has support for just about everything. I could talk for hours with you because it's so interesting and there's so much to talk about, but I think it's probably time to wrap up. So thank you so much. And we wish you all the best.
Thank you.
Thank you.
Same to you.
And so thank you for sharing your stories with Disabled People's Channel, and thank you to everyone for watching as well.